I think challenges. I said there are actually two. The first one is that we take mental health promotion seriously. So this means we look at whole population mental health. It's not just a question of getting better services to people who experience mental disorders and providing them with better care and treatment. That's very important. But it's about how do we actually reduce the prevalence rates of mental disorder across the country, and that's a difficult one to crack. The second thing I would say is let's look at the mental health of our children and young people. We know that 50% of adult mental health problems are experienced by children when they're younger. So if we tackle children's mental health, if we make children mentally healthier, we'll have fewer adult mental health problems in the future.
I think the key challenge is focusing on outcomes in terms of patient-reported outcomes and clinical outcomes. And I think if the whole health and social care economy focus on outcomes as its mechanism for getting delivery in the next 3 or 4 years, then we will be getting it right.
And what does that mean to you on the ground? How are you actually going to do it and put it into practice?
Well, I think everybody accepts that outcome measures nationally are emerging and they're quite in their infancy. So for us, we're really trying to focus on working with users and carers to develop patient-reported outcome measures as well as the clinically driven ones. So I think there's a real piece of work to do in terms of engaging those users and carers to get to that position.
How much of a challenge do you think it's going to be to actually involve the service users, the patients, and get them to take part in the process?
I think users and carers are really keen to make sure that the real measures that mean something to them are actually looked at as part of delivering services. I think the key challenge is going to be how you get an individual outcome measure structure that actually aggregates up and actually generates some outcomes that can be systematically looked at. So I think that's the real tension in the system at the minute.
You're looking forward to it?
I am, yes.
Well, one of the things that we're very interested at the King's Fund is about how different elements of the system, how different aspects of people's care connect up with each other. So that's what people talk about as the integrated care agenda. And when we talk about that, generally we talk about integration of primary and secondary care, integration of health and social care. One of the things I think is really, really important is that we don't forget the mental health bit of this, because integration is, and connecting different elements of care is really, really important for people who use mental health services. Just because you use a mental health service, of course, it doesn't mean that you don't have physical health needs and social care needs and so on. So one of the issues in the system at the moment is that too often people's mental health needs and physical healthcare needs are dealt with in a kind of siloed, fragmented way, and there's lots of opportunities to have a more kind of joined up approach.
So one of the key challenges that I think for improving mental health care is how we're going to measure what improvement looks like. And to do that, we really need to get a grip on measuring the outcomes that matter to patients. And that means moving beyond the number of days people spend in hospital, beyond the number of outpatients appointments that they have, and really getting to capture in a systematic way whether people have jobs, whether people are actually feeling happier, whether people have stable housing. So that's one of the main challenges. Another key challenge, I think, is about how we begin to improve life expectancy for people with severe and enduring mental illness. We know that on average, people with severe and enduring mental illness die at least 20 years earlier than people who don't. And that's quite simply because we don't do a good job at looking after their physical healthcare needs. So I think this is a massive challenge. And to meet that challenge, we're going to have to start integrating mental health care into primary care settings. We're going to have to start integrating mental health care across all acute care settings. And that's in a way that we haven't done before. Mental health has traditionally been quite siloed. So how are we going to do that? Well, I don't think this necessarily looks like having a psychiatrist in every primary care setting. I think we can do a lot with peer schemes. We can do a lot with community psychiatric nurses. We can do a lot with training physical healthcare nurses and GPs to do a better job of picking up mental health care and addressing physical healthcare needs.